Well, it is that time of year again where we are gearing up for the Desert AIDS Walk. And one of the main reasons people say they're walking this year is in response to the pandemic. So right now we have David Brinkman, CEO of the Desert AIDS Project, to talk about this a little more. Good morning.
Thanks for having me.
You're so welcome. Tell me about DAP's response to COVID.
You know, because our roots are in HIV, our infectious disease clinicians knew about COVID-19 before most people knew the word. And in early March, we were designing a testing and symptom treatment clinic to respond to COVID in this region of the Coachella Valley. As soon as we launched it and started testing people, we started bringing in additional support services to help people, whether it's mental health programs or delivery of food and groceries to people's homes while they quarantine.
I think what's so cool, what I learned about your organization, is that you have created a really simple way for people to get the care that they need. Instead of having to go to multiple appointments, they could do it all in one shot, right?
You can do it all in one shot under one roof at DAP, and anybody can access our COVID clinic regardless of insurance or regardless of primary care provider. Over 3,500 residents of our region have accessed it to date. Over 350 people just call our nurses on our COVID hotline each day to seek medical advice and how they should respond to COVID. And we invite all people to do that.
That's a good point, too. You also offer virtual appointments, right, for those that can't get to you?
That's right. You know, I think part of providing proactive care during this pandemic is doing it via virtual. And so we're able to do that for behavioral health appointments, dentistry appointments, primary care appointments, and also connect people with our nurses in our COVID hotline.
But your actual facility, the Triage Clinic, can you explain a little bit about what goes on there, what services are provided?
So in the Triage Clinic, we're testing people for COVID, but also other upper respiratory illnesses, and soon we'll be testing people for the flu as well. We're treating for people for symptoms who they need oxygen or similar respiratory issues addressed. And then if they do test positive for COVID, we are helping them quarantine at home safely, providing them additional support, food, basic household supplies, things of that nature.
Excellent. Now, you mentioned you don't need insurance, but if somebody's wondering, I don't know if I qualify for these kind of services, what do they need to know?
So insurance is not required to receive care at DAP. But I would say for the viewers who are asking that question, we have a number to call. It's our one call program, and people can dial that number and we can enroll them into Covered California or other public benefits all in one phone call. And if they don't qualify, we can also offer them a sliding fee schedule so they can access care.
That's so wonderful. You do such wonderful work there. And again, to kick it all off, we're going to have a half-hour special telling people more about what you do. It'll be on October 23rd right here on NBC Palm Springs. David Brinkman, thank you for joining us this morning.
Thanks for having me.
And we'll be right back.